I'm Bob Hewitt. I'm the on-staff clinician with R-Dent Laboratories, and I'm part of their technical support team. I'm a retired general dentist, and I practiced in Memphis for 40 years. Today I'd like to talk to you about adjusting the full contour zirconia crown. Some laboratories call it the Bruxzir crown. We call it the R-Brux crown. It's a true monolithic restoration. It has tremendous flexural strength, fracture toughness, high impact strength, and it's very resistant to thermal shock. In 2 words, it's basically bulletproof. This restoration can be used in clinical applications where you wouldn't think of using a ceramic restoration. Anything this far posteriorly and this as thin as this restoration is used to have to be made out of gold or some kind of metal restoration. However, the unique physical properties of this restoration require that we use special diamonds to adjust it. If you use regular operative diamonds, they have a tendency to wear out in a very short period of time, so it's not economically feasible to use the regular operative diamonds, and we've put together a special adjustment kit, and I'll show that to you in just a second here. This is the full zirconia adjustment kit. It's composed of 3 diamonds and 2 polishing points. The first diamond on here is the Bruxzir diamond, and it's the most aggressive of all the diamonds that we use. It's used for endodontic access, and it's used to completely remove a crown. The next one is the football diamond, and it's used for adjusting the proximal contacts. It's also used to define the occlusal grooves and anatomy. And then we have a small round diamond that can likewise be used for occlusal adjustment, and it can be used for endo access on incisors. And the 2 polishing points, the green polishing point is the toughest one, and the high shine is the white one. And one thing about zirconia is the fact that when you polish it, it retains that polish. It doesn't diminish over the years, so it has a low abrasiveness on the natural tooth. We're going to be adjusting the proximal contact on this number 18 crown, and we're just putting a little Sharpie marker on here so we can see where it's binding. And we're going to be using the football diamond to make that adjustment. It's a nice smooth diamond, and it's not that aggressive. We pressed the crown to place with thumb pressure and brought it back out, and we can see we've got a little spot right here where it's binding on the proximal, and we're going to be making that adjustment with the football diamond. Okay, we're going to make an adjustment right here. Take a little bit of the proximal off there. We've got a little occlusal interference on the mesial buccal cusp and the distal buccal cusp, and we're going to be using the football diamond here to make that adjustment. Normally we would use water spray, but when we're trying to film this video, you wouldn't be able to see what we were doing, so we're going to run it dry. Well, we're picking up a mark here on number 19, which indicates that we're beginning to get it in range. Now we're bringing the buccal cusp down a little bit with this football diamond. And in just a second, we're going to switch off to the small round diamond and make an adjustment right here in the central fossa. Now we're going to adjust the central fossa area here. Okay, we finished with the diamonds, and we're just coming back and putting a high shine where we've adjusted this proximal area. And on the occlusal surface, we've adjusted that in several spots. We're going to come back and this is a low-speed, high-torque handpiece electric engine. And it puts a real nice high shine with this green point And we're going to finish everything down with the white point. You'll be amazed at the beautiful high polish that you get with these pointed rubber polishing points. They really do put a nice shine on everything. And in closing, I want to say that it's really not rocket science. There's nothing different about adjusting these crowns as opposed to adjusting any other kind of crown. It's just that they are so tough and strong that they just wear the average diamond out, and it's not economically feasible to be trying to use operative diamonds. And I recommend that you keep all the diamonds, the 3 diamonds and the polishing points together in the autoclavable burr block. Don't substitute these diamonds for any kind of operative procedure. You need to make sure that you keep them all together so that you can identify them.